This is an enterprise by Medico Abroad to highlight the importance of self-study amongst medical students. Medicine is a vast subject, and the more you study it, the more you realize that every bit of knowledge gained is but a drop in a never-ending ocean. This is an effort to assist future physicians, and it should not by any means be treated as a substitute for regular classes. Now, having said that, one does gather a lot of knowledge during the medical course, but it's like leading a horse to water. How much the horse drinks is definitely up to the horse, isn't it? But on a more serious note, once you become doctors, you become trustees of the human body. The well-being of your patient is your responsibility. Therefore, you must equip yourself with all the knowledge that you can gather. There's an old Chinese proverb which says, "You hear and you forget. You see and you remember. You do and you learn." There can be no substitute to the student's initiative to learn better and to do more. You can augment your knowledge from a number of books. As you know, the lower limbs are attached to the trunk at the pelvic girdle. Okay? Now, the upper and lower limbs are actually homologous, which means that they are anatomically alike, but they are modified according to the function that they perform. Now, the lower limb can be divided just like the upper limb. Now, you know that the upper limb is divided into a arm which has one bone, a forearm which has two bones, and a hand. Similarly, the lower limb can be divided into a thigh which corresponds to the arm in the upper limb, a leg which corresponds to the forearm in the upper limb, and a foot which corresponds to the hand in the upper limb. Therefore, the parts of the lower limb are thigh, which articulates with the pelvic girdle at the hip joint. The thigh and the leg articulate with one another at the knee joint, and the foot. The articulation between the leg and the foot is at the ankle joint. The three parts of the lower limb are a thigh, a leg, and a foot. Now, just like the bones in the upper limb, you have one single bone in the thigh. One single bone in the thigh, which is the femur. The leg has two bones, tibia and fibula, and we'll come to the foot bones later. Now, the articulation between the lower limb and the trunk happens at the hip joint, where the hip bone articulates with the upper end of the femur, okay, to suspend the weight of the lower limb. Now, unlike the other animals in the animal kingdom, human beings have an upright posture, means they walk on two legs. Okay, that's called a bipedal posture. Now, when the posture becomes erect, when the posture becomes upright or erect, the weight of the limb, the weight of the entire body passes through the lower limb. Now, the line of gravity actually passes behind the hip joint, okay, behind the hip joint, but in front of the knee and the ankle joints. Now, it's a natural tendency for the hip, the pelvic girdle, to tilt backwards. This is prevented by attaching the hip to the knee joint by a very strong iliotibial tract. We'll come to the individual parts later. Okay, so first let's study the bones which suspend the weight of the lower limb. The articulation at the hip joint is between the hip bone and the femur. First, we are going to study these two bones. First, we will study the hip bone. The hip bone forms part of the pelvic girdle. It takes two hip bones, okay, and one sacrum at the back to form the entire pelvic girdle. Now, there's one hip bone on the right side, the other hip bone on the left side. In between both the hip bones, anteriorly, form the pubic symphysis. okay, and posteriorly they both articulate with the sacrum or the tailbone. This forms the pelvic girdle. Now the femur is attached to the hip bone, okay. The hip joint is formed between the hip bone and the head of the femur. Now we're going to study a part of the hip joint, that is the hip bone. Now there are two hip bones, one on either side, a right hip bone and a left hip bone. The hip bone is also called an innominate bone or a coxa, a coxal bone, okay. These are the other names given to a hip bone. Now the hip bone is part of your flat bones. It's an irregular bone, okay, and it has a depression called the acetabulum and an expanded area above and below the acetabulum. An acetabulum is nothing but a cup-shaped depression present on the hip bone, which is present laterally where the head of the femur articulates. The hip joint is a ball and socket joint. This is your socket of the hip joint, okay. The acetabulum forms a cup-shaped depression, okay, which is the socket for the hip joint. The ball of the hip joint is the head of the femur. Now this is your hip bone, okay. Now as you can see, it's an irregular bone. You can't really describe a particular shape. Now this is the way it is held anatomically, okay. This is the way it is held. This is the left hip bone. This is the area where the other hip bone articulates, okay. It forms anteriorly the pubic symphysis, yeah. Now as you can see, there is a large gap inside the hip bone here. This is called the obturator foramen. It's okay. It's called the obturator foramen. This is your acetabulum. This is the acetabulum, okay. It's directed laterally, forwards and downwards. This is how it is directed. This is the outer surface of the hip bone. This is the inner surface of the hip bone. Now as you can see, this is a wide expanded area, okay. It's a wide expanded area. Now we have said that the hip bone is expanded above and below the acetabulum, okay. Both the sides it is expanded. Now the hip bone, one hip bone, is actually formed by union of three different bones, okay. They are the ilium or the flank bone, the ischium and the pubis. There are three bones which form one hip bone. The ischium and the pubis are ventral. They are anterior or ventral bones. The dorsal bone is the ilium or flank. Now all three participate in formation of the acetabular socket. All three participate in forming your acetabulum, okay. You will find a triradiate cartilage or a cartilage which is in three pieces contributed by each of these three bones, and it fuses to form the acetabulum. Now this part is the pubis. This part is the pubis. The middle part is your ischium. Your dorsal part here is your ilium. This is called the flank. When you actually stand with hands on your hips, yes, this is the part that you are actually holding. This is the part where your hand is holding. This part is called the iliac crest. This is called the expanded iliac crest. Now the iliac crest anteriorly shows you a anterior superior iliac spine or ASIS. The ilium shows you a prominence here called the anterior superior iliac spine. Now if there is an anterior superior iliac spine, there should also be a anterior inferior iliac spine. Also posteriorly a posterior superior iliac spine and a posterior inferior iliac spine. Now this class we are not really going to look over each and every minute detail of the hip bone. I am just going over the main points that you need to know, okay. We have already said the hip bone is made up of three parts: ilium, pubis and ischium. All three participate in formation of the acetabulum. The pubis, the pubic bone, participates in formation of the pubic symphysis. There's a large opening called the obturator foramen. This is the iliac crest. The ilium is also called the flank bone. This is the anterior superior iliac spine. Now as you come posteriorly and inside here, this is the inside surface of the hip bone, right? Now this is called the iliac fossa. This is called the iliac fossa. On the outside, this is called the gluteal region, because the gluteal muscles take their origin from here. This is called the gluteal region. This is called the iliac fossa. Now as you can see, on the iliac side of the hip bone, you have this area which is called the auricular area or the auricular region, which is shaped like a ear. That's why it's called auricular. Yeah, this is where the sacrum articulates. This is the area for the sacroiliac joint. Okay, that is the posterior joint of the pelvis or the pelvic girdle. This is where the sacrum articulates, at the posterior surface of the hip bone. Now as you can see here, you have this depression called the greater sciatic notch. This is called the greater sciatic notch. There is a ligament which completes this greater sciatic notch and makes it into a greater sciatic foramen. Okay. Now the greater sciatic foramen transmits certain structures from inside the pelvic cavity into the lower limb. The main muscle which comes out of the greater sciatic foramen is the piriformis. The piriformis muscle comes out through the greater sciatic foramen, and there are different structures which pass above the muscle and below the muscle. Okay, they pass from inside the pelvic cavity into the lower limb. The sciatic nerve is one important content in the greater sciatic foramen. Okay, now this is the ischial spine. This is the ischial spine. Anteriorly here you will find the pubic tubercle. Pubic tubercle. Now the pubic tubercle and the anterior superior iliac spine are very important landmarks which you need to remember. Okay, so these are all the important parts of your hip bone. This picture shows you the outside surface of your hip bone. As you can see, this is your acetabulum. Acetabulum. Now it is 3/4 of a cup. Okay, the inferior end is left open. Now here there is something called a transverse ligament which completes the cup of the acetabulum. This is the socket of the hip joint. The ball of the hip joint is the head of the femur, and this articulation produces your hip joint which suspends the lower limb from the pelvic girdle. This is the acetabulum. The other important feature that you will find is this gap called the obturator foramen. Now the hip bone is an irregular bone, but it is made up of 3 different bones which are fused together. The pubic bone or the pubis, the ischium and the ilium, which is the dorsal bone. The ilium is the dorsal bone, the ischium and the pubis are anterior bones. Okay, so there are 3 bones which unite to form the hip bone. Now this is the pubic tubercle, ischiopubic ramus, and here the opposite side of the pelvic bone unites to form the pubic symphysis. This eminence, as you continue your finger along the pubic bone, the first eminence you will find from the pubic tubercle is your anterior, as you go upwards like this, anterior superior iliac spine. Okay, anterior superior iliac spine. Okay, this is the iliac crest. Now the outside surface displays 3 different lines, and this is called the gluteal region, where the gluteal muscles take origin from. This is the anterior gluteal line, posterior gluteal line. Okay, so these are your gluteal lines from where the gluteal region gives origin to its muscles. Now this is the anterior border of the hip bone. The posterior border of the hip bone, as it continues downwards, will show you the greater sciatic notch, which is made into a greater sciatic foramina by attachment of ligaments. Okay, the piriformis muscle is an important content of this foramen along with the sciatic nerve. This is the ischium. This part here would be the ischial tuberosity. So this is the outside or external surface of the hip bone. This chart shows you the internal surface of the hip bone. The other side of the pubis articulates here to form the pubic symphysis. So this is the symphysial surface of the hip bone. This is the obturator foramen. This is the lesser sciatic notch, ischial spine and the greater sciatic notch. Auricular surface where the sacroiliac joint is formed, where the hip bone articulates with the sacrum. Now this is the medial border of the hip bone. This internally is the iliac fossa. So these are the important features of your hip bone. The next bone that we're going to study is the femur. The femur is also called the thigh bone. Now this is a long bone and the longest bone in the body. Okay, it's the longest bone in the body. Now it has two ends, an upper end which articulates with the hip joint. Okay, we have already said that the hip joint is a ball and socket joint. The ball of the hip joint is contributed by the head of the femur. Okay, the head of the femur. Now followed by the head there is a neck which continues down as the shaft. Okay, and the lower end of the femur has two condyles, a medial and a lateral condyle. Now just after the neck you have two trochanters which are bony prominences, a greater trochanter and a lesser trochanter. Now on the posterior surface of the femur there is an important line called the linea aspera which we will come across during the attachment of various structures. Okay, now let's look at the bone. This is the left sided femur. How will you find which sided femur it is? The head of the femur points to which side of the femur it is. Okay, this is the head of the femur and it articulates with the hip joint. This is the ball, this is the acetabulum. Okay, this is the acetabulum. So this becomes the hip joint. It's a ball and socket joint. The acetabulum is a cup-shaped depression. Now because of the cup-shaped depression of the acetabular cavity, it has a very close attachment to the head of the femur. Yes. Now the similar thing you will find also in the shoulder joint between the glenoid cavity and the humerus. But if you notice, the glenoid cavity is very shallow. It's not as deep as the acetabulum. The reason is that the upper limb has a lot more freedom of movement than your hip joint. It's necessary because the hip joint has to bear almost the entire weight of the rest of the body, right? Therefore, this depression needs to be quite convex to enclose the entire head of the femur. The stability is increased in the hip joint, but at the expense of the mobility. Yes, the stability is increased at the expense of mobility. The mobility of the hip joint is restricted due to this reason. Okay, now we have said that the upper end of the femur has a head. This is the neck. Just after the neck you will find this, the greater trochanter. Posterior surface you will find lesser trochanter. This is the shaft. Okay, the anterior shaft of the humerus. Posteriorly on the shaft you will find this line called the linea aspera. This line called the linea aspera. At the lower end of the femur you will find this expanded region. Here it forms the knee joint. Here it forms the knee joint with the patella in front and the tibia and fibula at the inferior part. Okay, now this is the lower end of the femur. It has a medial condyle and a lateral condyle. Near the lateral condyle you have this called the adductor tubercle. This is called the adductor tubercle.